Hi, welcome to our Pharma Topics channel. Our topic of discussion is Racecadotril Loperamide and Diphenoxylate, which are used as antidiarrheals. Racecadotril is a prodrug that is rapidly converted to thiorphan, which is a enkephalinase inhibitor. It prevents the degradation of endogenous enkephalins, which are delta opioid receptor agonists. It increases the intestinal hypersecretion without affecting the motility. It lowers the mucosal cyclic AMP due to enhanced enkephalin secretion. It is indicated for a short-term treatment of acute secretory diarrhea and is most safe in children. The adverse effects are nausea, vomiting, drowsiness, and flatulence. Let us see about bismuth subsalicylate. It is anti-secretory in nature. It decreases prostaglandin synthesis in the intestinal mucosa, reduces chloride secretion. It is used for the prophylaxis of travelers diarrhea. And next is anticholinergics. They reduce the bowel motility and secretion, useful in nervous or drug-induced diarrheas, and can provide symptomatic relief in the dysenteries. Let us see the diphenoxylate or diphenoxin. These are synthetic opioids related to pethidine, have prominent antidiarrheal effect. It carries the risk of abuse liability, which is tackled with the addition of atropine in the formulation. It may cause respiratory depression, paralytic ileus, and toxic megacolon in the children. So it is contraindicated for children below 6 years of age. Loperamide, it's a opiate analog, peripheral mu agonist with a weak anticholinergic property. It lacks CNS effects, analgesic and abuse liability. Additionally, it inhibits the intestinal secretions. Adverse effects, toxic megacolon may occur in the children. So loperamide is not advisable for children less than 4 years. So it's a very short nutshell information of racecadotril, anticholinergics, bismuth, diphenoxylate, and loperamide, which are useful as antidiarrheals. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel for further updates. Thank you.